Today we're talking about the differences between Pulse Lavage and Whirlpool. We'll start with the indications. First with Whirlpool, we have necrotic wounds, moderate to heavy exudate, wound with debris, and wounds with need for moderate to vigorous perfusion. Pulse Lavage is all of those, as well as patients with venous insufficiency, incontinence, ICU, and wounds with tunneling. Next, we'll flip the board, and we'll talk about the contraindications and precautions. Contraindications for Pulse Lavage, there are none. For Whirlpool, there are quite a few, and they are clean or granulated wound, epithelialized wound, new skin graft, new tissue flap, venous ulcers, non-necrotic diabetic ulcers, moderate to severe edema, lethargy, maceration, acute phlebitis, renal failure, dry gangrene, incontinence, and febrile conditions. The precautions, Pulse Lavage has insensate, anticoagulants, near major vessels, cavity lining, bypass graft sites, exposed nerve, tendon, bone, or vessels, grafts or flaps, and then facial wounds. For Whirlpool, the precautions are water temp for PVD, cardiopulmonary issues, clotting and healing, and sensory loss.
So next we're going to talk a little bit about the pros and cons of Pulse Lavage and Whirlpool. So we'll start with Pulse Lavage. Some of the pros are that you avoid maceration of the tissue. There's a less likelihood of cross-contamination with treatment. You promote granulation and epithelialization, and you also have a higher, or you have an increased bacterial removal from the wound. The big con for Pulse Lavage is that it is expensive. You do have to get rid of each device after you've used it once, so that can be not very cost effective. And then for Whirlpool, your pros are you have increased vasodilation, you get softening of necrotic tissue, cleanses and removes exudate, stimulates granulation tissue, has a sedation and analgesic effect from either the warm or the cold water. And cons are you have maceration of the skin, you can increase tissue damage, you have a higher likelihood of wound infection from poor cleanliness of the Whirlpool, and you're also put in a dependent position, so you can have increased edema.